Question 1. The review process indicates a need to assess a certified clinical hypnotherapist, CCHt, understanding of the underlying mechanisms of hypnosis. When explaining to a client how hypnosis works, which of the following comparative analyses of neurophysiological and psychological perspectives best reflects current professional understanding and ethical practice for a CCHt? Option A. Hypnosis is primarily a state of heightened suggestibility driven by the client's expectations and the therapist's persuasive communication, with any perceived neurophysiological changes being secondary or coincidental to the psychological suggestion. Option B. Hypnosis involves a complex interplay between observable changes in brain activity, such as altered neural connectivity and neurotransmitter modulation, and psychological factors like heightened suggestibility, focused attention, and altered states of consciousness, working in concert to facilitate therapeutic change. Option C. Hypnosis is a form of self-hypnosis initiated by the client's conscious decision to relax and focus, with the therapist acting as a facilitator rather than a direct influence on neurophysiological or psychological states. Option D. Hypnosis is fundamentally a neurobiological phenomenon characterized by specific patterns of brainwave activity and neurotransmitter release, with psychological experiences being merely epiphenomenal byproducts of these underlying physiological processes. Correct answer is B. Hypnosis involves a complex interplay between observable changes in brain activity, such as altered neural connectivity and neurotransmitter modulation, and psychological factors like heightened suggestibility, focused attention, and altered states of consciousness, working in concert to facilitate therapeutic change. Explanation: this scenario is professionally challenging because it requires a certified clinical hypnotherapist, CCHt, to differentiate between two prominent theoretical frameworks explaining the mechanisms of hypnosis, applying them to a client's experience. The CCHt must demonstrate a nuanced understanding of both neurophysiological and psychological perspectives, recognizing their distinct contributions and potential overlaps, without oversimplifying or misrepresenting either. Careful judgment is required to select the explanation that most accurately and ethically reflects the current understanding within the profession, aligning with the standards expected of a CCHt. The correct approach represents best professional practice because it acknowledges the integrated nature of hypnosis, recognizing that both neurophysiological changes and psychological processes are at play. This aligns with the evolving scientific understanding of hypnosis, which moves beyond a purely psychological or purely biological explanation. By referencing the interplay between brain activity, e.g., altered connectivity, changes in neurotransmitter levels, and psychological factors, e.g., expectation, dissociation, suggestibility, this approach provides a comprehensive and evidence-based explanation for the client. This comprehensive understanding supports ethical practice by ensuring the client receives accurate information about their therapeutic experience, fostering trust and informed consent. It also demonstrates adherence to professional standards that encourage continuous learning and the integration of scientific advancements into practice. An incorrect approach that focuses solely on neurophysiological changes without acknowledging the psychological components would be professionally unacceptable. This failure would stem from an incomplete understanding of hypnosis, potentially leading to a reductionist explanation that neglects the client's subjective experience and the crucial role of their cognitive and emotional state. Ethically, this could be seen as a failure to adequately inform the client about the multifaceted nature of their treatment. Another incorrect approach that emphasizes only psychological factors, such as mere suggestion or placebo effect, while dismissing any underlying neurobiological correlates, would also be professionally unacceptable. This overlooks the substantial body of research demonstrating measurable changes in brain function during hypnosis. Such an approach risks trivializing the client's experience and the efficacy of hypnosis as a therapeutic modality, potentially violating ethical obligations to provide accurate and evidence-based information. The professional decision-making process for similar situations should involve 1. Actively seeking and integrating current research on the neurophysiological and psychological mechanisms of hypnosis. 2. Critically evaluating theoretical models for their comprehensiveness and empirical support. 3. Considering the client's individual presentation and tailoring explanations to their understanding and needs, while maintaining scientific accuracy. 4. Prioritizing explanations that reflect the consensus within the professional community and are supported by robust evidence, ensuring ethical and effective client care. Question 2. The analysis reveals that a certified clinical hypnotherapist, CCHt, is working with a client who reports experiencing a profound sense of relaxation and detachment during hypnosis, describing it as a distinct trance state. However, the CCHt primarily subscribes to a non-state theory of hypnosis, viewing the process as a form of focused attention and suggestion, without necessarily requiring an altered state of consciousness. CCHt must decide how to integrate the client's subjective experience with their theoretical framework to ensure effective and ethical practice. Which of the following represents the most appropriate professional approach? Option A. Gently correct the client's perception, explaining that the feeling of a trance state is a common misinterpretation and that the therapeutic benefits are solely derived from focused attention and suggestion, regardless of subjective feelings. Option B. Acknowledge the client's subjective experience of a trance state as a valid and potentially beneficial aspect of their hypnotic experience, integrating it into the therapeutic process without necessarily needing to reconcile it with a strict non-state theoretical model. Option C. Focus exclusively on the observable behavioral changes and the efficacy of the suggestions, dismissing the client's subjective description of a trance state as irrelevant to the therapeutic outcome. Option D. Inform the client that their subjective experience is incompatible with the CCHt's theoretical model, suggesting they seek a therapist who adheres to state theory for a more aligned experience. The correct answer is B. Acknowledge the client's subjective experience of a trance state as a valid and potentially beneficial aspect of their hypnotic experience, integrating it into the therapeutic process without necessarily needing to reconcile it with a strict non-state theoretical model. Explanation. This scenario presents a professional challenge because it requires the certified clinical hypnotherapist, CCHt, to navigate differing theoretical perspectives on hypnosis while maintaining ethical and regulatory compliance. The core of the challenge lies in applying a theoretical model that best serves the client's needs and aligns with the established scope of practice for a CCHt, without imposing a personal theoretical bias that could hinder therapeutic progress or violate professional standards. Careful judgment is required to select an approach that is evidence-based and client-centered. The correct approach represents best professional practice because it acknowledges the client's subjective experience and the observable behavioral changes associated with hypnosis, aligning with a pragmatic and client-focused application of hypnotherapy. This approach prioritizes therapeutic outcomes and respects the client's journey, which is consistent with the ethical imperative to act in the client's best interest. Regulatory frameworks for CCHt typically emphasize efficacy and client well-being, supporting models that demonstrate practical benefits regardless of the underlying theoretical debate. An incorrect approach that rigidly adheres to a state theory, dismissing any client reports that don't fit a specific altered state, fails ethically by potentially invalidating the client's experience and hindering rapport. This could lead to a therapeutic impasse, violating the duty of care. From a regulatory standpoint, such rigidity might be seen as a failure to adapt therapeutic techniques to individual client needs, a core tenet of competent practice. Another incorrect approach that solely focuses on non-state mechanisms, dismissing the subjective experience of altered awareness as irrelevant, also presents ethical and regulatory concerns. While acknowledging non-state mechanisms is valid, completely disregarding the client's subjective experience can lead to a depersonalized therapeutic encounter. This could be interpreted as a failure to establish a therapeutic alliance, which is crucial for effective hypnotherapy and is often implicitly or explicitly required by professional guidelines. The professional decision-making process for similar situations should involve a thorough client assessment, including understanding their expectations and prior experiences with hypnosis. The CCHt should then select and explain the theoretical framework that best supports the chosen therapeutic interventions, ensuring it is adaptable to the client's responses. Transparency with the client about the theoretical underpinnings in an accessible manner fosters trust and collaboration. The ultimate decision should be guided by the principle of do no harm and the goal of achieving positive therapeutic outcomes within the bounds of professional competence and regulatory guidelines. Question 3. The control framework reveals that a certified clinical hypnotherapist, CCHt, is working with a client who is experiencing mild anxiety and has a history of feeling easily overwhelmed. The therapist aims to deepen the client's hypnotic state to facilitate therapeutic work. Which of the following methods for deepening hypnotic states best aligns with the CCHt's professional responsibilities and regulatory guidelines? Option A. Utilizing a complex visualization exercise involving a challenging journey through a dense forest, assuming this will automatically lead to a deeper state of hypnosis, regardless of the client's comfort level. Option B. Employing a progressive relaxation technique, gradually guiding the client to notice deeper sensations of calm and heaviness in their body, while regularly checking in with the client's subjective experience and offering opportunities for them to adjust the pace. Option C. Immediately initiating a rapid induction, followed by a series of intense, rapid-fire suggestions for deep trance, without prior assessment of the client's tolerance for such intensity. Option D. Implementing a countdown from 10, with each number accompanied by a forceful command to go deeper, and ignoring any subtle signs of discomfort from the client. The correct answer is B. Employing a progressive relaxation technique, gradually guiding the client to notice deeper sensations of calm and heaviness in their body, while regularly checking in with the client's subjective experience and offering opportunities for them to adjust the pace. Explanation. This scenario presents a professional challenge due to the inherent variability in client responses to hypnotic deepening techniques. A certified clinical hypnotherapist, CCHt, must exercise careful judgment to select and adapt methods that are both effective and ethically sound, ensuring client safety and therapeutic progress. The regulatory framework for CCHt emphasizes client-centered care, informed consent, and the use of evidence-based practices. The correct approach represents best professional practice because it prioritizes a systematic, client-responsive method for deepening hypnotic states. This involves initial assessment, gradual introduction of techniques, and continuous monitoring of the client's subjective experience and physiological responses. This aligns with the CCHt's ethical obligation to provide competent and individualized care, ensuring that deepening techniques are not applied rigidly, but are tailored to the client's needs and comfort level. Regulatory guidelines for CCHt stress the importance of maintaining client well-being and therapeutic efficacy, which this approach directly supports. An incorrect approach that relies solely on a single, aggressive deepening technique without prior assessment or client feedback poses significant regulatory and ethical risks. Such a method could lead to client distress, anxiety, or even a premature emergence from trance, undermining the therapeutic goals. This would violate the CCHt's duty of care and potentially breach ethical codes regarding client safety and informed consent. Another incorrect approach that involves introducing complex or novel deepening techniques without adequate training or understanding of their potential impact on the client is also professionally unacceptable. This demonstrates a lack of competence and could lead to unintended negative consequences, contravening regulatory standards for professional practice. A third incorrect approach that focuses on achieving a specific depth of trance, regardless of the client's experience or therapeutic benefit, disregards the client's autonomy and well-being, which are paramount in clinical hypnotherapy. This can be seen as a failure to adhere to ethical principles of beneficence and non-maleficence. Professionals should employ a decision-making framework that begins with a thorough client assessment, including their history, presenting issues, and previous experiences with hypnosis. This is followed by a discussion of potential deepening techniques, obtaining informed consent, and then implementing techniques in a gradual, monitored manner. Ongoing assessment of the client's response, both verbally and non-verbally, is crucial for adapting the approach as needed. This iterative process ensures that the deepening of the hypnotic state is a collaborative and safe experience, aligned with the client's therapeutic journey and professional standards. Question 4. The monitoring system demonstrates that a certified clinical hypnotherapist, CCHt, is preparing to utilize imagery and visualization techniques for a client experiencing performance anxiety. The hypnotherapist has conducted an initial assessment, but is now considering different approaches to the visualization exercise. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for CCHt practice in utilizing imagery and visualization? Option A. Develop a visualization script that incorporates a variety of sensory details, visual, auditory, kinesthetic, olfactory, gustatory, and allows for client input on which elements are most impactful for them. Option B. Focus solely on auditory cues, such as a calming voice guiding the client through a generic success scenario, disregarding other sensory modalities. Option C. Utilize abstract metaphorical imagery that represents overcoming obstacles, without first confirming the client's understanding or preference for such abstract concepts. Option D. Immediately implement a highly detailed visual-only script of a successful performance scenario, assuming this is universally effective for performance anxiety. The correct answer is A. Develop a visualization script that incorporates a variety of sensory details, visual, auditory, kinesthetic, olfactory, gustatory, and allows for client input on which elements are most impactful for them. Explanation. The scenario presents a common challenge in hypnotherapy, tailoring imagery and visualization techniques to a client's unique sensory preferences and cognitive style while adhering to professional standards. The professional challenge lies in balancing client-centered care with the ethical imperative to provide interventions that are not only effective, but also safe and appropriate, avoiding any suggestion of therapeutic claims beyond the scope of practice. Careful judgment is required to discern between techniques that are genuinely beneficial and those that might be ineffective or even counterproductive due to a mismatch with the client's internal experience. The correct approach represents best professional practice because it prioritizes a thorough client assessment to understand their preferred sensory modalities, visual, auditory, kinesthetic, olfactory, gustatory, and their capacity for abstract versus concrete visualization. This aligns with the ethical guidelines for certified clinical hypnotherapists, CCHt, which mandate client-centered practice, informed consent, and the use of evidence-informed techniques. By actively inquiring about the client's experiences and preferences, the hypnotherapist ensures the imagery is personally meaningful and accessible, thereby maximizing the potential for therapeutic benefit and respecting the client's autonomy. This approach avoids making assumptions and instead builds the intervention collaboratively, which is a cornerstone of ethical and effective hypnotherapy. An incorrect approach that relies solely on generic visual imagery fails to acknowledge the diversity of human perception and cognitive processing. This can lead to a disconnect where the client cannot fully engage with the visualization, rendering the intervention ineffective. Ethically, this could be seen as a failure to provide competent care, as it does not adequately assess or adapt to the client's needs. Another incorrect approach that involves introducing complex, abstract metaphors without prior assessment risks confusing or overwhelming the client, potentially leading to anxiety or a sense of failure on their part. This violates the principle of do no harm and the ethical requirement to ensure interventions are understandable and manageable for the client. A third incorrect approach that focuses exclusively on auditory cues, ignoring other sensory channels, similarly limits the potential effectiveness and fails to provide a comprehensive, client-tailored experience, thus falling short of best practice standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Initial assessment. Conduct a detailed intake to understand the client's presenting issue, their goals, and their preferred learning and sensory styles. This includes asking open-ended questions about how they best imagine or experience things. 2. Collaborative technique selection. Based on the assessment, propose and discuss potential imagery and visualization techniques, explaining how they might work and inviting client feedback on their suitability. 3. Gradual introduction and adaptation. Begin with simpler, more accessible imagery and gradually introduce more complex or multisensory elements as the client demonstrates comfort and engagement. Be prepared to modify or abandon a technique if it is not resonating with the client. 4. Ongoing evaluation. Continuously monitor the client's response during the session, observing for signs of engagement, understanding, or distress, and adjust the approach accordingly. Question 5. During the evaluation of a client who expresses a desire to overcome procrastination, but also voices apprehension about being told what to do, which type of suggestion would be most professionally appropriate to employ during the hypnotherapy session? Option A. A series of vague and ambiguous statements that offer no clear direction or outcome. Option B. Indirect suggestions that utilize metaphors and permissive phrasing to guide the client's unconscious mind towards taking action. Option C. Direct commands that explicitly instruct the client to stop procrastinating and start working immediately. Option D. Suggestions that focus solely on the negative consequences of procrastination without offering alternative behaviors. The correct answer is B. Indirect suggestions that utilize metaphors and permissive phrasing to guide the client's unconscious mind towards taking action. Explanation. This scenario presents a professional challenge because the certified clinical hypnotherapist, CCHt, must select the most appropriate suggestion type based on the client's presentation and the therapeutic goal, while adhering to ethical guidelines and best practices. The client's resistance to direct commands necessitates a nuanced approach to avoid alienating them or hindering the therapeutic process. Careful judgment is required to balance the efficacy of different suggestion types with the client's comfort and receptiveness. The correct approach, utilizing indirect suggestions, represents best professional practice because it respects the client's autonomy and acknowledges their potential resistance. Indirect suggestions, such as metaphors, embedded commands, and permissive language, allow the client to internalize the desired change at an unconscious level without feeling coerced. This aligns with ethical principles of client-centered care and informed consent, ensuring the client feels empowered and in control of their therapeutic journey. Regulatory frameworks for CCHt typically emphasize client well-being and the use of techniques that are congruent with the client's individual needs and preferences. An incorrect approach involving solely direct, authoritarian suggestions would be professionally unacceptable. This fails to acknowledge the client's stated resistance and could lead to a breakdown in the therapeutic alliance. Ethically, it disregards the client's expressed needs and could be perceived as manipulative or disrespectful, potentially violating principles of beneficence and non-maleficence. Regulatory bodies for CCHt would likely view such an approach as a failure to provide competent and ethical care, as it does not adapt to the client's unique presentation. Another incorrect approach, relying exclusively on vague or ambiguous suggestions without clear therapeutic intent, would also be professionally problematic. While indirect suggestions are valuable, they must still be guided by a clear therapeutic objective. Ambiguous suggestions may not effectively facilitate the desired change and could lead to confusion or frustration for the client, undermining the effectiveness of the hypnotherapy session. This could be seen as a failure to provide a structured and evidence-informed therapeutic intervention, potentially falling short of professional standards of care. The professional decision-making process for similar situations should involve a thorough initial assessment of the client's personality, history, and receptiveness to different hypnotic techniques. The CCHt should actively listen to the client's verbal and nonverbal cues, adapting their approach in real time. When faced with resistance, the therapist should explore the underlying reasons for that resistance before proceeding. The choice between direct and indirect suggestions should be a deliberate, client-informed decision, prioritizing techniques that foster trust, rapport, and a sense of collaboration, thereby maximizing the potential for positive therapeutic outcomes within ethical and regulatory boundaries. Question 6. Governance review demonstrates a certified clinical hypnotherapist, CCHt, has a client who has researched anchoring techniques and specifically requests the implementation of a particular complex anchoring method for their anxiety. The client is insistent, stating they believe this specific technique will be the most effective. What is the most ethically sound and professionally responsible course of action for the CCHt? Option A. Conduct a thorough assessment of the client's suitability for the requested anchoring technique, discuss its potential benefits and risks, and explore any necessary modifications or alternative approaches that align with the client's goals and professional best practices. Option B. Proceed with a simplified version of the requested anchoring technique, assuming the client's research indicates some level of understanding, without a full assessment of its specific suitability for this individual. Option C. Refuse to use the requested anchoring technique, explaining that the CCHt will only use methods they have personally developed or are standard in their practice, without further discussion. Option D. Immediately implement the client's requested anchoring technique as they have researched it and are insistent to ensure client satisfaction and maintain the therapeutic alliance. The correct answer is A. Conduct a thorough assessment of the client's suitability for the requested anchoring technique, discuss its potential benefits and risks, and explore any necessary modifications or alternative approaches that align with the client's goals and professional best practices. Explanation. This scenario presents a professional challenge because it requires the certified clinical hypnotherapist, CCHt, to balance the client's stated desire for a specific anchoring technique with the ethical imperative to ensure the technique is appropriate, safe, and aligned with professional standards. The client's insistence on a particular method, even if potentially beneficial, necessitates careful consideration of the CCHT's professional judgment and responsibility. The correct approach represents best professional practice because it prioritizes client well-being and adherence to ethical guidelines. By thoroughly assessing the client's needs and suitability for the requested anchoring technique, and by explaining alternative or modified approaches if necessary, the CCHT upholds their duty of care. This involves a collaborative process where the client's input is valued, but the ultimate decision-making rests on the professional's expertise and ethical obligations to avoid harm and promote therapeutic benefit. This aligns with the core principles of client-centered care and professional accountability expected of a CCHT. An incorrect approach that proceeds with the client's requested anchoring technique without adequate assessment or consideration of alternatives fails to meet professional standards. This could lead to an ineffective or even detrimental therapeutic outcome, violating the principle of beneficence and non-maleficence. It also bypasses the professional's responsibility to guide the client towards the most appropriate therapeutic interventions, potentially leading to a breach of professional conduct if the technique is not suitable or if informed consent is not properly obtained regarding its application and potential limitations. Another incorrect approach, which is to dismiss the client's request outright without exploration, demonstrates a lack of client-centeredness and can damage the therapeutic alliance. The CCHT has a responsibility to ensure appropriateness. A rigid refusal without explanation or exploration can be perceived as dismissive and uncollaborative, potentially hindering the client's engagement with therapy. This fails to acknowledge the client's agency and their role in their own healing process. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and exploration. Understand the client's request, their rationale, and their expectations. 2. Assessment of suitability. Evaluate if the requested technique is appropriate for the client's specific goals, history, and presentation, considering potential contraindications. 3. Informed consent and education. Clearly explain the proposed technique, its benefits, risks, and alternatives. Ensure the client understands and agrees to the chosen approach. 4. Professional judgment and adaptation. If the requested technique is not ideal, explain why and propose modifications or alternative techniques that are more suitable while still respecting the client's input. 5. Documentation. Record the client's request, the assessment, the discussion, and the agreed-upon plan. Question 7. The control framework reveals that a certified clinical hypnotherapist, CCHt, is considering employing a rapid induction technique for a new client presenting with acute anxiety. The client has expressed a strong desire for immediate relief. Which of the following actions best aligns with the regulatory requirements and ethical standards for a CCHT in this situation? Option A. Utilize a rapid induction technique that has been successful with previous clients, assuming it will be equally effective for this individual. Option B. Proceed with a well-established rapid induction technique immediately, given the client's expressed desire for swift relief and the urgency of their anxiety. Option C. Employ a rapid induction technique that involves a significant degree of surprise or unexpected stimuli to quickly bypass conscious resistance. Option D. Conduct a thorough pre-induction assessment to evaluate the client's suitability for rapid induction, discuss the technique's nature and potential outcomes, and obtain explicit informed consent before proceeding. The correct answer is B. Proceed with a well-established rapid induction technique immediately, given the client's expressed desire for swift relief and the urgency of their anxiety. Explanation. This scenario presents a professional challenge due to the inherent variability in client responses to rapid induction techniques. A certified clinical hypnotherapist, CCHt, must balance the client's immediate need for therapeutic benefit with the paramount ethical and regulatory obligation to ensure client safety and informed consent. The speed of induction, while desirable for efficiency, can potentially bypass crucial stages of rapport building and client understanding, leading to unintended consequences or a compromised therapeutic alliance. Careful judgment is required to assess client suitability, manage expectations, and adapt techniques in real time, all within the established professional and regulatory boundaries. The correct approach represents best professional practice because it prioritizes client well-being and adherence to the CCHt regulatory framework. This involves a thorough pre-induction assessment to determine the client's suitability for rapid techniques, ensuring they understand the process and potential outcomes, and obtaining explicit informed consent. It also necessitates ongoing monitoring of the client's state throughout the induction, and a willingness to modify or abandon the technique if any signs of distress or lack of engagement are observed. This aligns with the CCHt's duty of care, which mandates that all therapeutic interventions are conducted in a manner that is safe, effective, and respects the client's autonomy and dignity. An incorrect approach that involves employing a rapid induction technique without a prior assessment of the client's suitability for such methods represents a significant regulatory and ethical failure. This bypasses the fundamental requirement for a thorough client evaluation, which is essential for identifying contraindications or potential risks associated with rapid interventions. It also fails to adequately inform the client about the specific nature of the technique, its potential benefits, and any associated risks, thereby undermining the principle of informed consent. Furthermore, proceeding with a technique that may not be appropriate for the individual client can lead to adverse reactions, such as anxiety, confusion, or a feeling of being out of control, which constitutes a breach of the duty of care. Another incorrect approach would be to rigidly adhere to a chosen rapid induction technique even when the client exhibits signs of discomfort or disengagement. This demonstrates a lack of professional judgment and an inability to adapt to the client's immediate needs. Ethically, this is unacceptable as it prioritizes the therapist's agenda over the client's experience and safety. From a regulatory standpoint, it violates the principle of providing competent and responsive care, potentially leading to a compromised therapeutic outcome and a breach of professional standards. The professional decision-making process for similar situations should involve a systematic approach. 1. Client assessment. Conduct a comprehensive assessment to understand the client's history, presenting issues, and their receptivity to hypnosis. This includes evaluating their suitability for rapid induction techniques. 2. Informed consent. Clearly explain the proposed induction technique, including its rapid nature, potential benefits, risks, and alternatives. Ensure the client fully understands and voluntarily agrees to proceed. 3. Technique selection and adaptation. Choose a rapid induction technique that is appropriate for the client's assessed needs and profile. Be prepared to modify or abandon the technique based on the client's real-time responses. 4. Monitoring and feedback. Continuously monitor the client's physiological and psychological state throughout the induction. Encourage verbal and nonverbal feedback. 5. Ethical and regulatory adherence. Ensure all actions are consistent with the CCHt Code of Ethics and relevant regulatory guidelines, prioritizing client safety, autonomy, and well-being at all times. Question 8. Regulatory review indicates that a certified clinical hypnotherapist, CCHt, is presented with a client seeking to overcome a deeply ingrained fear of public speaking, characterized by significant anxiety and a history of avoidance. The therapist considers employing a direct, authoritative approach to instill confidence, a permissive, indirect style that utilizes the client's own metaphors and experiences, or training the client in self-hypnosis techniques for ongoing practice. Which of the following best reflects the most appropriate and ethically sound application of hypnotic modalities in this scenario, considering the client's complex presentation? Option A. Prioritizing the use of Ericksonian hypnosis, which leverages indirect suggestions and the client's unique frame of reference to address the underlying roots of the fear and build coping mechanisms, while also considering training in self-hypnosis for sustained empowerment. Option B. Recommending self-hypnosis as the primary intervention, assuming the client can independently overcome the fear through guided recordings without further therapeutic guidance. Option C. Employing a direct, traditional hypnotic approach with strong, authoritative suggestions aimed at immediately replacing anxious thoughts with confident ones, believing this will be the quickest and most effective solution. Option D. Focusing solely on traditional, authoritarian suggestions to override the client's fear response, without exploring the client's personal experiences or providing tools for self-management. The correct answer is A. Prioritizing the use of Ericksonian hypnosis, which leverages indirect suggestions and the client's unique frame of reference to address the underlying roots of the fear and build coping mechanisms, while also considering training in self-hypnosis for sustained empowerment. Explanation. This scenario presents a professional challenge because a certified clinical hypnotherapist, CCHt, must accurately assess and apply different hypnotic modalities to meet client needs while adhering to professional standards and ethical guidelines. The challenge lies in distinguishing the core principles and appropriate applications of traditional, Ericksonian, and self-hypnosis techniques, ensuring that the chosen method is both effective for the client's presenting issue and compliant with the CCHT's scope of practice and ethical obligations. The correct approach, which involves understanding and applying the nuances of each modality to tailor treatment, represents best professional practice. This aligns with the CCHT's responsibility to provide evidence-based and client-centered care. Specifically, a CCHT is expected to be proficient in various techniques to offer a comprehensive service. For instance, when a client presents with a specific, well-defined goal, a more direct, traditional approach might be indicated. If the client's issues are complex, deeply rooted, or involve resistance, Ericksonian techniques, with their indirect suggestions and utilization of the client's own frame of reference, are often more appropriate and ethically sound, respecting client autonomy. Self-hypnosis training empowers clients, fostering independence and long-term self-management, which is a cornerstone of ethical therapeutic practice, promoting client agency and reducing reliance on the therapist. An incorrect approach would be to rigidly apply one technique, regardless of client presentation, or to misinterpret the core principles of each. For example, attempting to use highly directive, traditional suggestions with a client who is resistant or has complex psychological issues could be ineffective and potentially counterproductive, violating the ethical principle of beneficence, doing good and non-maleficence, avoiding harm. Similarly, misrepresenting self-hypnosis as a panacea for all issues or failing to adequately train a client in its practice would be an ethical failure, potentially leading to client disappointment and a lack of desired outcomes, thereby failing to uphold professional competence. Another failure would be to confuse the indirect, permissive style of Ericksonian hypnosis with a lack of structure, leading to a disorganized session that does not effectively address the client's goals. Professional decision-making in such situations requires a thorough client assessment, including understanding their presenting problem, their goals, their personality, and their receptivity to different therapeutic styles. The CCHT must then draw upon their knowledge of various hypnotic modalities, considering their theoretical underpinnings, typical applications, and potential contraindications. The decision should be guided by the principle of least harm and maximum benefit for the client, always prioritizing their well-being and therapeutic progress. This involves a dynamic process of selecting, adapting, and potentially integrating techniques based on ongoing client feedback and observed progress, ensuring that the chosen approach is ethically sound and professionally responsible. Question 9. Benchmark analysis indicates that a certified clinical hypnotherapist, CCHt, is reviewing historical texts on hypnosis to inform their understanding of the field. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for current CCHt practice? Option A. Integrating hypnosis with pseudoscientific or fringe practices that have historically been associated with the term, as these demonstrate the broad historical spectrum of hypnotic phenomena. Option B. Disregarding historical accounts of hypnosis entirely, as they are considered irrelevant to the modern evidence-based practice of clinical hypnotherapy. Option C. Defining hypnosis primarily through its historical manifestations, such as early-stage performances and theories of animal magnetism, as these represent the foundational understanding of the practice. Option D. Prioritizing the definition and application of hypnosis based on current scientific research, evidence-based therapeutic techniques, and the established ethical code for CCHTS, while acknowledging historical developments as context. The correct answer is D. Prioritizing the definition and application of hypnosis based on current scientific research, evidence-based therapeutic techniques, and the established ethical code for CCHTS, while acknowledging historical developments as context. Explanation. Scenario analysis. This scenario presents a professional challenge where a certified clinical hypnotherapist, CCHt, must navigate the historical context of hypnosis while adhering strictly to current regulatory frameworks and ethical guidelines for practice. The challenge lies in distinguishing between historical understandings of hypnosis, which may have been less regulated or ethically nuanced, and the contemporary professional standards that govern CCHt practice. Misinterpreting or misapplying historical information could lead to practices that are not evidence-based, potentially harmful, or in violation of current professional conduct codes. Correct approach analysis. The correct approach demonstrates an understanding that, while the history of hypnosis provides valuable context, current practice must be grounded in the established regulatory framework and ethical guidelines for certified clinical hypnotherapists. This involves recognizing that historical theories or practices, such as those associated with mesmerism or early-stage hypnosis, may not align with the scientific understanding and therapeutic applications of hypnosis as defined by current professional bodies and regulatory oversight. Best professional practice dictates that a CCHt's definition and application of hypnosis are informed by contemporary research, evidence-based techniques, and the ethical principles that safeguard client well-being and professional integrity, as outlined by the CCHt certification standards. This approach prioritizes client safety, efficacy of treatment, and adherence to the legal and ethical boundaries of the profession. Incorrect approach is analysis. One incorrect approach might involve defining hypnosis solely through its historical manifestations, such as early theatrical demonstrations or theories of animal magnetism. This fails to acknowledge the evolution of hypnosis into a recognized therapeutic modality supported by scientific research and regulated practice. Such an approach could lead to the adoption of outdated, potentially ineffective, or even harmful techniques, and would be a failure to adhere to the current professional standards and evidence-based practices required for CCHt certification. It also risks misrepresenting the scope and nature of clinical hypnosis to clients. Another incorrect approach could be to conflate clinical hypnosis with pseudoscientific or fringe practices that have historically been associated with hypnosis but lack empirical support. This would represent a significant ethical and regulatory failure, as CCHt practice is predicated on evidence-based interventions. Adopting such practices would violate the principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, and would likely contravene specific clauses within the CCHt Code of Ethics regarding professional competence and the use of scientifically validated techniques. A third incorrect approach might be to dismiss the historical development of hypnosis entirely, viewing it as irrelevant to current practice. While current practice must be evidence-based, understanding the historical trajectory of hypnosis can offer insights into its development, the challenges it has faced, and the reasons for the establishment of current regulatory and ethical frameworks. Ignoring history entirely can lead to a superficial understanding of the profession and a failure to appreciate the foundations upon which current standards are built, potentially leading to a less nuanced and informed professional judgment. Professional reasoning. Professionals should approach this by first understanding the current regulatory and ethical landscape governing their practice as a CCHt. This involves familiarizing themselves with the specific requirements for certification, the Code of Ethics, and any relevant legal statutes. When considering the history of hypnosis, it should be viewed as a contextual element that informs the evolution of the field, rather than a prescriptive guide for current practice. The decision-making process should always prioritize client safety, evidence-based interventions, and adherence to the established professional standards. This involves critically evaluating historical information through the lens of contemporary scientific understanding and ethical considerations, ensuring that any application of hypnotic techniques is aligned with current best practices and regulatory mandates. Question 10. Market research demonstrates that clients often present with preconceived notions about their issues and desired therapeutic outcomes. A new client arrives stating they have anxiety attacks and are convinced that a specific hypnotherapy script for panic disorder is what they need. As a certified clinical hypnotherapist, CCHt, what is the most ethically and professionally sound approach to this initial client interaction? Option A. Immediately implement the specific hypnotherapy script for panic disorder that the client requested, as this demonstrates responsiveness to their expressed needs. Option B. Advise the client that hypnotherapy is not suitable for anxiety attacks and suggest they seek alternative medical or psychological treatment. Option C. Proceed with a general relaxation hypnotherapy session, as this is a safe and universally beneficial intervention for most presenting issues. Option D. Conduct a thorough assessment to understand the client's history, symptoms, and potential contributing factors, and then collaboratively determine the most appropriate therapeutic approach, which may or may not be the initially requested script. The correct answer is D. Conduct a thorough assessment to understand the client's history, symptoms, and potential contributing factors, and then collaboratively determine the most appropriate therapeutic approach, which may or may not be the initially requested script. Explanation. This scenario presents a professional challenge because the hypnotherapist must balance the client's stated desire for a specific outcome with the ethical and regulatory imperative to conduct a thorough and appropriate assessment. The client's self-diagnosis, while potentially accurate, cannot be the sole basis for treatment planning. The Certified Clinical Hypnotherapist (CCHt) designation implies adherence to a professional standard of practice that prioritizes client safety and well-being, which necessitates a comprehensive evaluation before initiating therapeutic interventions. The correct approach represents best professional practice because it aligns with the core principles of ethical hypnotherapy and client-centered care. A thorough assessment, including gathering a detailed history, exploring presenting issues, and identifying contraindications, is fundamental to establishing a safe and effective therapeutic relationship. This process ensures that the hypnotherapist has a clear understanding of the client's needs, potential risks, and the suitability of hypnotherapy for their specific situation. It also allows for the development of a tailored treatment plan that is evidence-informed and ethically sound, adhering to the guidelines expected of a CCHt. An incorrect approach that relies solely on the client's self-diagnosis fails to meet professional standards. This bypasses the essential step of independent clinical evaluation, potentially leading to inappropriate or ineffective treatment. Ethically, it could be considered a failure to exercise due diligence and professional judgment. It also risks misinterpreting the client's condition, which could exacerbate existing issues or introduce new ones. Furthermore, it may violate regulatory requirements that mandate a proper intake and assessment process for all clients seeking therapeutic services, ensuring that the practitioner is qualified to address the client's concerns. Another incorrect approach that immediately proceeds with a predetermined intervention based on the client's stated desire, without adequate assessment, is equally problematic. This demonstrates a lack of critical thinking and a failure to adhere to best practices in client evaluation. It prioritizes the client's immediate request over a comprehensive understanding of their needs, potentially leading to a superficial or ineffective therapeutic outcome. This approach neglects the ethical obligation to ensure that the chosen modality is the most appropriate and beneficial for the client's overall well-being. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate the client's stated concerns and desired outcomes. 2. Initiate a comprehensive intake and assessment process, gathering detailed history, exploring presenting problems, and identifying any potential contraindications or co-occurring conditions. 3. Utilize clinical reasoning to determine the suitability of hypnotherapy for the client's specific situation, considering the evidence base for its efficacy. 4. Collaboratively develop a treatment plan with the client, clearly outlining goals, interventions, and expected outcomes, ensuring informed consent. 5. Regularly review and adjust the treatment plan based on the client's progress and evolving needs. Question 11. Implementation of informed consent for a client presenting with symptoms of anxiety and sleep disturbances, who expresses a strong desire to use hypnotherapy to address these issues, should prioritize which of the following actions? Option A. Providing a brief overview of hypnotherapy's general benefits for stress reduction, and then obtaining consent, assuming the client's request implies they have already considered other options. Option B. Immediately commencing a series of hypnotherapy sessions focused on relaxation techniques, as the client has explicitly requested hypnotherapy for their symptoms. Option C. Informing the client that hypnotherapy is not a primary treatment for anxiety and sleep disturbances, and advising them to seek medical or psychological evaluation before considering any hypnotherapy. Option D. Conducting a thorough assessment to understand the client's symptoms, medical history, and any potential contraindications for hypnotherapy, followed by a detailed discussion of the proposed hypnotherapy, its potential benefits, risks, limitations, and alternatives, ensuring the client's understanding before obtaining consent. Correct answer is D. Conducting a thorough assessment to understand the client's symptoms, medical history, and any potential contraindications for hypnotherapy, followed by a detailed discussion of the proposed hypnotherapy, its potential benefits, risks, limitations, and alternatives, ensuring the client's understanding before obtaining consent. Explanation. The scenario presents a common challenge in clinical practice where a client expresses a desire to explore hypnotherapy for a condition that may have underlying medical or psychological components requiring a broader scope of care. The professional challenge lies in balancing the client's autonomy and expressed wishes with the ethical and regulatory imperative to ensure client safety and appropriate care. This requires careful judgment to determine the extent to which hypnotherapy can be safely and effectively applied, and when referral or collaboration with other healthcare professionals is necessary. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the client's situation before proceeding with hypnotherapy. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Specifically, it adheres to the CCHt guidelines, which emphasize thorough assessment, including screening for contraindications and identifying the need for referral. Obtaining informed consent is not merely a procedural step, but a dynamic process that requires the client to have a clear understanding of the proposed treatment, its potential benefits, risks, limitations, and alternatives. This approach ensures that the client's consent is truly informed and voluntary, based on accurate information about their condition and the scope of hypnotherapy. An incorrect approach that involves immediately proceeding with hypnotherapy without a thorough assessment fails to uphold the principle of non-maleficence. If the client's condition requires medical or psychiatric intervention, proceeding with hypnotherapy alone could delay necessary treatment, potentially leading to adverse outcomes. This constitutes a regulatory and ethical failure by not adequately screening for contraindications or the need for referral, which are fundamental aspects of responsible practice. Another incorrect approach, which involves dismissing the client's request outright without exploring their motivations or providing information about potential benefits and limitations of hypnotherapy, fails to respect client autonomy and the principle of beneficence. While referral might ultimately be necessary, a complete dismissal without exploration can be perceived as a lack of empathy and may prevent the client from seeking appropriate help. This could be seen as a failure to adequately assess the client's needs and explore all viable therapeutic avenues within the scope of practice. A third incorrect approach, which involves providing a superficial overview of hypnotherapy without delving into the specific risks and benefits relevant to the client's stated concerns, results in consent that is not truly informed. The client may agree to treatment without fully understanding what it entails, particularly concerning potential limitations or the possibility that it may not address the root cause of their issues. This breaches the ethical requirement for comprehensive disclosure and can lead to unmet expectations and potential harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough assessment. Conduct a comprehensive intake and assessment to understand the client's presenting issues, history, and any relevant medical or psychological factors. 2. Risk/benefit analysis. Evaluate the potential benefits and risks of hypnotherapy for the specific client and their condition. 3. Scope of practice. Determine if the client's needs fall within the scope of practice for a certified clinical hypnotherapist. 4. Informed consent. Engage in a detailed discussion with the client about the proposed treatment, including its nature, purpose, potential outcomes, risks, limitations, and alternatives. Ensure the client has ample opportunity to ask questions and understands the information provided. 5. Referral and collaboration. If the assessment reveals conditions outside the scope of hypnotherapy or requiring specialized care, promptly and ethically refer the client to appropriate healthcare professionals. Maintain open communication and collaboration with other providers when beneficial for the client's care. 6. Documentation. Meticulously document all assessments, discussions, informed consent processes, and any referrals made. Question 12. Operational review demonstrates a certified clinical hypnotherapist, CCHt, is working with a client who expresses a strong desire for a specific, guaranteed outcome from their hypnotherapy sessions. The client is insistent that the therapist promise this exact result. Considering the ethical framework for CCHt practice, which of the following actions best upholds professional standards? Option A. Agree to the client's demand and promise the specific outcome they desire to ensure client satisfaction and maintain their engagement in therapy. Option B. Clearly explain to the client that while hypnotherapy can be a powerful tool for facilitating change, Specific outcomes cannot be guaranteed due to individual variability and the collaborative nature of therapy, and then proceed to collaboratively set realistic goals. Option C. Proceed with the hypnotherapy sessions as planned, focusing on the techniques without directly addressing the client's insistence on a guaranteed outcome, assuming they will understand the limitations implicitly. Option D. Inform the client that their expectation is unrealistic and that hypnotherapy cannot deliver such results, potentially leading to the termination of the therapeutic relationship if they persist. The correct answer is B. Clearly explain to the client that while hypnotherapy can be a powerful tool for facilitating change, specific outcomes cannot be guaranteed due to individual variability and the collaborative nature of therapy, and then proceed to collaboratively set realistic goals. Explanation. This scenario presents a professional challenge because it requires the certified clinical hypnotherapist, CCHt, to balance the client's expressed desire for a specific therapeutic outcome with the ethical imperative to practice within the scope of their competence and to avoid making unsubstantiated claims. The client's insistence on a particular result, especially one that might be perceived as a guarantee, necessitates careful navigation to maintain professional boundaries and uphold ethical standards. The correct approach represents best professional practice because it prioritizes client well-being and professional integrity. By acknowledging the client's goals while clearly stating the limitations of hypnotherapy and the therapist's role, the CCHt upholds the ethical principle of honesty and avoids making therapeutic claims that cannot be substantiated. This approach aligns with the CCHt's responsibility to provide accurate information about the process and potential outcomes, fostering a realistic and trusting therapeutic relationship. It also adheres to the ethical guidelines that prohibit guaranteeing specific results, as therapeutic outcomes are influenced by numerous individual factors. An incorrect approach that involves agreeing to guarantee the client's desired outcome is a significant ethical failure. This constitutes a breach of professional integrity and potentially misleads the client, setting unrealistic expectations that can lead to disappointment and damage the therapeutic alliance. It violates the ethical standard of practicing within one's scope of competence and making only truthful representations about the services offered. Another incorrect approach, that of dismissing the client's concerns and proceeding without addressing their expectations, is also professionally unacceptable. This demonstrates a lack of empathy and a failure to engage in collaborative goal setting, which is fundamental to effective therapy. It neglects the ethical duty to communicate openly and honestly with the client about their treatment plan and potential outcomes. A professional decision-making process for similar situations should involve active listening to the client's stated goals, followed by a clear and honest explanation of what hypnotherapy can realistically achieve. This includes discussing the collaborative nature of the therapeutic process, the client's active role in their own progress, and the inherent variability in therapeutic outcomes. The professional must then set clear boundaries regarding what can and cannot be guaranteed, ensuring that the client understands the limitations while still feeling supported and understood. Question 13. The evaluation methodology shows that a client's spouse contacts you, the certified clinical hypnotherapist, CCHt, requesting an update on the client's progress in hypnotherapy sessions, stating it is for the client's own good. The client has not provided any written or verbal consent for you to discuss their case with their spouse. Which of the following actions best upholds client confidentiality and privacy according to regulatory frameworks for CCHt? Option A. Share anonymized general information about the types of issues you address in hypnotherapy with the spouse, without mentioning the specific client. Option B. Provide a general overview of the client's progress to the spouse, assuring them that the client is working through their issues, as this is likely what the client would want. Option C. Politely decline the spouse's request, explaining that you are bound by strict confidentiality agreements and can only discuss the client's case with the client directly, unless explicit written consent is provided. Option D. Contact the client to inform them of their spouse's request and ask for their explicit permission to share specific details with the spouse. The correct answer is C. Politely decline the spouse's request, explaining that you are bound by strict confidentiality agreements and can only discuss the client's case with the client directly, unless explicit written consent is provided. Explanation. The evaluation methodology shows that maintaining client confidentiality is a cornerstone of ethical and legal practice for a certified clinical hypnotherapist, CCHt. This scenario presents a professional challenge because it involves a potential conflict between a client's expressed desire for privacy and a third party's request for information that could be perceived as relevant to the client's well-being, but without explicit consent. Careful judgment is required to navigate this delicate balance, ensuring that the hypnotherapist upholds their professional duty of care while strictly adhering to privacy regulations. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the client before disclosing any information. This aligns directly with the fundamental ethical principles of autonomy and respect for persons, and is mandated by regulatory frameworks governing health and therapy professions, which typically require written consent for the release of protected health information. This approach ensures that the client remains in control of their personal data and that the hypnotherapist acts with integrity and transparency. An incorrect approach that involves disclosing information without explicit consent, even if the request comes from a family member or seems to be in the client's best interest, constitutes a significant regulatory and ethical failure. This violates the client's right to privacy and breaches confidentiality, potentially leading to legal repercussions, loss of client trust, and damage to the hypnotherapist's professional reputation. Such an action disregards the legal and ethical obligations to protect client information, which are paramount in clinical practice. Another incorrect approach, such as attempting to infer what the client would want without direct communication, is also professionally unacceptable. This bypasses the essential step of informed consent and can lead to misinterpretations and the disclosure of information the client would not wish to share. It demonstrates a lack of understanding of the legal and ethical requirements for handling client data and a failure to engage in proper professional decision-making. The professional reasoning process for similar situations should involve a clear understanding of the applicable regulatory framework and ethical codes. When faced with a request for client information, the hypnotherapist must first identify the source of the request and the nature of the information sought. The primary step is always to consult with the client and obtain their explicit, informed consent for any disclosure. If the client is unable to provide consent due to incapacitation, the hypnotherapist must refer to established legal and ethical guidelines regarding surrogate consent or the disclosure of information in emergencies, always erring on the side of maximum privacy protection unless legally compelled otherwise. Documentation of all communications and decisions is crucial. Question 14. The efficiency study reveals that while direct, rapid suggestion-based inductions can shorten session times, a CCHt is working with a new client who expresses anxiety about losing control during hypnosis. The CCHt must choose between immediately implementing a rapid, direct suggestion-based induction to achieve a quick state of relaxation, or employing a more gradual, permissive induction that allows the client to explore their comfort level with suggestion. Option A. Employ a gradual, permissive induction, but avoid discussing the nature of suggestions to prevent overwhelming the client with technical details. Option B. Implement a rapid, direct suggestion-based induction, assuring the client that they will remain in control even though the technique is being applied without their explicit prior agreement on this specific method. Option C. Employ a gradual, permissive induction, explaining the process and offering the client choices in how suggestions are delivered to address their anxiety about control. Option D. Utilize a rapid, direct suggestion-based induction, focusing solely on achieving a deep state of relaxation as quickly as possible to demonstrate the effectiveness of hypnotherapy. The correct answer is C. Employ a gradual, permissive induction, explaining the process and offering the client choices in how suggestions are delivered to address their anxiety about control. Explanation. This scenario is professionally challenging because the certified clinical hypnotherapist, CCHt, must balance the client's immediate need for relaxation with the ethical imperative to ensure the client's autonomy and understanding of the hypnotic process. The CCHt must also adhere to the specific regulatory framework governing hypnotherapy practice, which emphasizes informed consent and the avoidance of undue influence. The correct approach represents best professional practice because it prioritizes client autonomy and informed consent, core tenets of ethical hypnotherapy. By offering a choice of induction techniques and explaining their rationale. The CCHt empowers the client to participate actively in their treatment. This aligns with the regulatory framework's emphasis on client-centered care and the avoidance of manipulative practices. Transparency about the purpose and nature of suggestions fosters trust and ensures that the client is not being subjected to techniques they have not agreed to or do not understand. An incorrect approach that involves unilaterally imposing a rapid induction technique without prior discussion or consent would represent a significant ethical and regulatory failure. This could be construed as a violation of informed consent, as the client has not had the opportunity to agree to the specific method used. Furthermore, it could be seen as a failure to respect client autonomy, potentially leading to feelings of disempowerment or mistrust. Another incorrect approach, such as using vague or overly suggestive language during the induction that could be misinterpreted or lead to unintended outcomes, would also be a regulatory and ethical breach. This highlights the importance of clear, precise, and client-appropriate language, ensuring that suggestions are therapeutic and aligned with the client's goals, not coercive or misleading. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's needs, preferences, and any contraindications. This is followed by a clear explanation of the proposed therapeutic process, including potential induction techniques and the rationale behind them. The client's informed consent must be obtained before proceeding. Throughout the session, the professional must remain attuned to the client's responses and be prepared to adjust techniques as needed, always prioritizing the client's well-being and ethical practice. Question 15. Investigation of a certified clinical hypnotherapist's response to a client's invitation to their wedding, where the client has expressed that the therapist's presence would mean a great deal to them and has been a significant support during a difficult period. The therapist has been seeing this client for 6 months for anxiety management. Option A. Accept the invitation, but inform the client that the therapist will only be able to stay for a short period and will not engage in any therapeutic discussions. Option B. Suggest that the client invite the therapist to a less personal event, like a community gathering, to further strengthen their bond outside of therapy. Option C. Politely decline the invitation, explaining that maintaining professional boundaries is essential for effective therapy and client well-being, and suggest an alternative way to acknowledge the client's milestone, such as sending a card. Option D. Accept the invitation and attend the wedding as a social guest, viewing it as a positive step in the client's recovery and a sign of a strong therapeutic alliance. The correct answer is C. Politely decline the invitation, explaining that maintaining professional boundaries is essential for effective therapy and client well-being, and suggest an alternative way to acknowledge the client's milestone, such as sending a card. Explanation. This scenario presents a professional challenge due to the inherent power imbalance in the therapeutic relationship and the potential for exploitation when a therapist engages in dual relationships. The certified clinical hypnotherapist, CCHt, is entrusted with the client's vulnerability and well-being. The ethical and regulatory framework for CCHt, as defined by relevant professional bodies and potentially state licensing boards, assuming a U.S. jurisdiction for this exam context, as no other is specified, mandates clear boundaries to protect clients. The correct approach prioritizes client welfare and professional integrity by maintaining strict boundaries. This aligns with ethical codes that prohibit dual relationships that could impair professional judgment, exploit the client, or create a conflict of interest. Specifically, it upholds the principle of do no harm and ensures the therapeutic relationship remains focused on the client's needs, free from personal gain or entanglement for the therapist. This approach demonstrates adherence to the CCHt's professional responsibilities and the trust placed in them. An incorrect approach involving accepting the invitation to the client's wedding would represent a significant ethical and regulatory failure. This constitutes a dual relationship, therapist, client, and social acquaintance, that blurs professional boundaries. Such a relationship can lead to impaired objectivity, making it difficult for the therapist to provide unbiased and effective treatment. It also carries a high risk of exploitation, as the client may feel obligated to reciprocate social gestures, or the therapist may unconsciously alter their therapeutic approach to maintain the social connection. Furthermore, it could create a conflict of interest, where the therapist's personal enjoyment or social standing becomes intertwined with the therapeutic process. This violates core ethical principles of maintaining professional distance and avoiding situations that could compromise the therapeutic alliance or client well-being. Another incorrect approach, such as agreeing to attend but keeping it strictly professional and avoiding personal conversation, still fails to adequately address the inherent risks. While attempting to maintain a professional demeanor, the act of attending a personal event like a wedding inherently shifts the dynamic and introduces social context that is difficult to compartmentalize. The client may perceive the therapist's presence as a form of endorsement or personal connection that extends beyond the therapeutic setting, potentially leading to discomfort or a feeling of being on display in a non-therapeutic context. This still risks blurring boundaries and can create an uncomfortable situation for both parties, undermining the therapeutic space. A professional decision-making process for similar situations should involve a clear assessment of the potential impact on the client and the therapeutic relationship. The therapist must first identify any potential dual relationships or boundary crossings. Then, they should consult relevant ethical codes and guidelines specific to their certification and jurisdiction. If there is any doubt about the appropriateness of a situation, the safest and most ethical course of action is to decline, prioritizing the client's best interests and the integrity of the therapeutic process. Seeking supervision or consultation from experienced colleagues can also provide valuable guidance in navigating complex ethical dilemmas. Question 16. What factors determine the appropriate course of action for a certified clinical hypnotherapist, CCHt, when a client presents with symptoms that could indicate a serious underlying medical condition? Option A. The CCHt's understanding of their defined scope of practice and the ethical obligation to refer to qualified medical professionals for diagnosis and treatment of medical conditions. Option B. The CCHt's personal belief in the efficacy of hypnotherapy to address all forms of physical discomfort, even without medical diagnosis. Option C. The client's expressed desire to explore the symptoms solely through hypnotherapy, regardless of potential medical implications. Option D. The perceived urgency of the client's symptoms, with the CCHt deciding to proceed with hypnotherapy if the symptoms do not appear immediately life-threatening. The correct answer is A. The CCHt's understanding of their defined scope of practice and the ethical obligation to refer to qualified medical professionals for diagnosis and treatment of medical conditions. Explanation. The scenario of a certified clinical hypnotherapist, CCHt, encountering a client presenting with symptoms suggestive of a serious medical condition is professionally challenging because it directly intersects the boundaries of their scope of practice with the critical need for client safety and well-being. The CCHt must exercise careful judgment to avoid misdiagnosis or delaying necessary medical intervention, which could have severe consequences for the client. The correct approach, which involves recognizing the limitations of hypnotherapy for diagnosing or treating medical conditions and referring the client to a qualified medical professional, represents best professional practice. This aligns with the ethical imperative to do no harm and the regulatory framework governing CCHTs, which mandates operating within their defined scope of practice. Specifically, this approach upholds the principle that hypnotherapy is a complementary or alternative modality, and not a substitute for conventional medical care. It ensures the client receives appropriate medical assessment and treatment from licensed healthcare providers. An incorrect approach of attempting to address the medical symptoms through hypnotherapy without medical consultation is a significant regulatory and ethical failure. This constitutes practicing outside the defined scope of a CCHt, potentially leading to a misdiagnosis or exacerbation of a medical condition. It violates the ethical duty to refer when a client's needs exceed the practitioner's expertise or scope. Another incorrect approach, such as downplaying the client's symptoms or suggesting hypnotherapy alone will resolve them, is also ethically unsound and potentially harmful, as it may lead the client to forego essential medical evaluation. This demonstrates a lack of professional responsibility and in disregard for client safety. The professional decision-making process for similar situations should involve a clear understanding of the CCHT's scope of practice as defined by their certification and relevant professional guidelines. This includes recognizing the signs and symptoms that fall outside the domain of hypnotherapy and require medical referral. A systematic approach would involve 1. Active listening and assessment to identify potential medical red flags. 2. Consulting professional ethical codes and practice guidelines to confirm appropriate action. 3. Clearly communicating the limitations of hypnotherapy to the client and the necessity of seeking medical advice. 4. Documenting the assessment, referral, and client communication thoroughly. Question 17. When evaluating the ethical and therapeutic efficacy of utilizing metaphors in hypnotherapy for a client experiencing generalized anxiety, what approach best aligns with the Certified Clinical Hypnotherapist, CCHt, professional standards and regulatory framework in the United States? Option A. Collaboratively exploring potential metaphors with the client, ensuring they are culturally sensitive and resonate with the client's personal experiences and values, and then introducing them with an explanation of their therapeutic purpose. Option B. Selecting a metaphor that the therapist personally finds powerful and universally applicable, and presenting it directly to the client during the hypnotic induction to facilitate immediate insight. Option C. Employing metaphors that are commonly found in popular self-help literature, assuming their widespread recognition guarantees their effectiveness and appropriateness for all clients. Option D. Utilizing complex, abstract metaphors that challenge the client's cognitive processing, believing that such intellectual engagement will lead to deeper therapeutic breakthroughs. The correct answer is A. Collaboratively exploring potential metaphors with the client, ensuring they are culturally sensitive and resonate with the client's personal experiences and values, and then introducing them with an explanation of their therapeutic purpose. Explanation. This scenario presents a professional challenge for a certified clinical hypnotherapist, CCHt, in the United States, specifically concerning the ethical and effective utilization of metaphors within the scope of practice, as governed by the American Society of Clinical Hypnosis, ASH, ethical guidelines, and relevant state licensing boards for mental health professionals. The challenge lies in balancing the therapeutic power of metaphors with the imperative to maintain client safety, informed consent, and professional boundaries. A CCHt must ensure that the metaphors used are not only therapeutically relevant, but also culturally sensitive, age-appropriate, and do not inadvertently introduce new anxieties or misinterpretations for the client. The correct approach involves a collaborative and client-centered selection and introduction of metaphors. This aligns with best professional practice by prioritizing the client's subjective experience and ensuring the metaphor serves as a tool for empowerment and insight, rather than imposing the therapist's narrative. Specifically, ASH ethical guidelines emphasize the importance of client autonomy and the therapist's responsibility to use techniques in a manner that is beneficial and not harmful. This approach respects the client's capacity to understand and integrate the metaphor, fostering a therapeutic alliance built on trust and shared understanding. The CCHt must be prepared to discuss the metaphor with the client, gauge their interpretation, and adjust as needed, ensuring the metaphor remains a supportive element of the therapeutic process. An incorrect approach would be to unilaterally select and impose a metaphor without client input or assessment of its potential impact. This could lead to ethical failures, such as a lack of informed consent regarding the specific therapeutic tools being employed. If the metaphor is culturally inappropriate or triggers unintended negative associations for the client, it could constitute a failure to provide competent and ethical care, potentially causing psychological distress. Furthermore, using a metaphor that is overly complex or abstract without adequate explanation or client engagement could be seen as a breach of professional responsibility, as it fails to serve the client's best interests and could be interpreted as a lack of understanding of the client's cognitive and emotional landscape. Such an approach risks alienating the client and undermining the therapeutic goals. The professional decision-making process for similar situations should involve a thorough client assessment, including their cultural background, belief systems, and current emotional state, before introducing any metaphorical language. The CCHt should always explain the purpose of using metaphors and invite client participation in selecting or adapting them. Transparency and ongoing dialogue with the client about their experience of the metaphor are crucial. If a metaphor appears to be causing distress or confusion, the CCHt must be prepared to immediately address it, offer clarification, or discontinue its use, always prioritizing the client's well-being and therapeutic progress. Question 18. Cost-benefit analysis shows that a comprehensive initial client assessment is vital for effective hypnotherapy, but the implementation can be challenging. Which of the following approaches to the initial client assessment best aligns with the ethical and professional standards for a certified clinical hypnotherapist, CCHt? Option A. Focusing primarily on identifying a specific diagnostic label for the client's issue, and then designing a hypnotherapy protocol based on generalized treatment plans for that diagnosis, with minimal client input on specific goals. Option B. Making definitive promises about the client's ability to achieve specific outcomes through hypnotherapy during the initial assessment to build confidence and encourage commitment to the therapeutic process. Option C. Conducting a brief, symptom-focused interview to quickly identify the primary issue, and then proceeding with a standard hypnotherapy induction, with the understanding that further adjustments can be made in subsequent sessions. Option D. Dedicating the initial session to a thorough exploration of the client's presenting problem, their history, their goals for therapy, and a clear explanation of the hypnotherapy process, its potential benefits and limitations, before any hypnotic induction occurs. The correct answer is C. Conducting a brief, symptom-focused interview to quickly identify the primary issue, and then proceeding with a standard hypnotherapy induction, with the understanding that further adjustments can be made in subsequent sessions. Explanation. This scenario presents a common implementation challenge in initial client assessment for a certified clinical hypnotherapist, CCHt. The challenge lies in balancing the need for comprehensive information gathering with the client's comfort, time constraints, and the ethical imperative to avoid overpromising or creating unrealistic expectations. A thorough initial assessment is crucial for establishing rapport, identifying appropriate therapeutic goals, and determining the suitability of hypnotherapy for the client's presenting issues. It also forms the basis for informed consent and the development of a tailored treatment plan. The correct approach emphasizes a structured yet flexible intake process that prioritizes understanding the client's core concerns, their history related to these concerns, and their expectations from hypnotherapy. This involves active listening, open-ended questioning, and a clear explanation of the hypnotherapy process, its potential benefits and limitations. This aligns with the ethical guidelines for CCHTs, which mandate thorough client assessment to ensure competence and to provide safe and effective care. It also respects the client's autonomy by involving them in goal setting and ensuring they have a clear understanding of the therapeutic relationship. Incorrect approaches fail to meet these professional standards. One incorrect approach might involve rushing through the assessment to begin the hypnotherapy session prematurely. This is ethically problematic, as it bypasses essential information gathering, potentially leading to an inappropriate intervention or a failure to address the client's true needs. It could also violate the principle of informed consent if the client is not fully apprised of the process and potential outcomes. Another incorrect approach could be to focus excessively on diagnostic labels without exploring the client's subjective experience and the impact of their concerns on their life. This can lead to a superficial understanding and a treatment plan that is not client-centered. Furthermore, making definitive promises about outcomes during the initial assessment is a significant ethical breach, as hypnotherapy, like any therapeutic modality, has variable outcomes and cannot guarantee specific results. This can lead to client dissatisfaction and damage the professional's reputation. The professional decision-making process for initial client assessment should involve a systematic approach. First, establishing a safe and trusting environment. Second, actively listening to the client's presenting problem and their history. Third, exploring their goals and expectations. Fourth, assessing their readiness for hypnotherapy and identifying any contraindications. And finally, clearly communicating the proposed therapeutic approach, its potential benefits, risks, and limitations, and obtaining informed consent. This process ensures that the CCHt acts within their scope of practice and upholds the highest ethical standards. Question 19. System analysis indicates that a certified clinical hypnotherapist, CCHt, is working with a client who reports experiencing vivid, dissociative-like sensations during hypnosis, which they describe as feeling like they are observing themselves from a distance, and are accompanied by unusual somatic sensations. The client expresses curiosity about the neurophysiological underpinnings of these experiences and asks if the hypnotherapist can use advanced hypnotic techniques to further explore and potentially resolve these dissociative sensations, believing they are directly linked to the hypnotic state itself. The CCHt has a foundational understanding of neurophysiological models of hypnosis, including altered states of consciousness and changes in brain activity associated with suggestibility and focus. Which of the following represents the most ethically sound and professionally responsible course of action for the CCHt? Option A. Proceed with advanced hypnotic techniques to deepen the dissociative-like sensations, aiming to help the client gain insight into the neurophysiological mechanisms directly through the hypnotic experience, as the client has requested further exploration. Option B. Inform the client that such subjective experiences are not typically associated with standard hypnotic phenomena and are likely unrelated to the hypnotherapy process, and therefore should be disregarded to maintain focus on the therapeutic goals. Option C. Acknowledge the client's subjective experiences and their interest in the neurophysiological aspects. Explain that, while hypnosis can induce altered states, the specific dissociative sensations described may warrant further investigation by a medical or licensed mental health professional, and offer to collaborate with such a professional if the client chooses to pursue that avenue, while continuing with standard hypnotherapy for their stated goals within the CCHt's scope. Option D. Immediately terminate the hypnotherapy session and refer the client to a psychiatrist, stating that their reported experiences are beyond the scope of clinical hypnotherapy and potentially indicative of a serious underlying psychological disorder. The correct answer is C. Acknowledge the client's subjective experiences and their interest in the neurophysiological aspects. Explain that, while hypnosis can induce altered states, the specific dissociative sensations described may warrant further investigation by a medical or licensed mental health professional, and offer to collaborate with such a professional if the client chooses to pursue that avenue, while continuing with standard hypnotherapy for their stated goals within the CCHt's scope. Explanation. This scenario presents a professional challenge due to the inherent complexity of understanding and applying neurophysiological and psychological mechanisms of hypnosis ethically and effectively within the scope of practice for a certified clinical hypnotherapist, CCHt. The challenge lies in discerning when a client's reported subjective experiences align with established neurophysiological models of hypnotic states, and when they might indicate a need for referral or a more cautious approach, particularly when those experiences are unusual or potentially indicative of underlying psychological distress beyond the typical scope of hypnotherapy. Careful judgment is required to balance the client's subjective reality with objective understanding of hypnotic phenomena and professional boundaries. The correct approach represents best professional practice because it prioritizes client safety and well-being by acknowledging the limits of hypnotherapy and the importance of interdisciplinary collaboration. It aligns with ethical guidelines that mandate practitioners to operate within their competence and to refer clients to other professionals when their needs exceed the practitioner's expertise or scope of practice. Specifically, for a CCHt, this would involve adhering to the ethical codes and practice standards that emphasize client welfare, informed consent, and the recognition of when a client's presentation may require the attention of a medical doctor or licensed mental health professional. This approach ensures that the client receives the most appropriate and comprehensive care, respecting the boundaries of hypnotherapy as a modality. An incorrect approach that involves attempting to directly address or treat the client's unusual subjective experiences solely through advanced hypnotic techniques, without considering potential underlying medical or psychological conditions, represents a significant regulatory and ethical failure. This failure stems from practicing outside the established scope of competence, potentially causing harm by delaying or preventing appropriate medical or psychological intervention. It violates the principle of do no harm and the ethical obligation to refer when necessary. Another incorrect approach, such as dismissing the client's subjective experiences as irrelevant to the hypnotic process, is also ethically problematic. This dismissiveness can erode the therapeutic alliance, fail to acknowledge the client's lived experience, and potentially overlook crucial information that might inform the therapeutic approach or indicate a need for referral. It demonstrates a lack of empathy and a failure to engage with the client's holistic presentation. Professional decision-making in similar situations should involve a systematic process. First, a thorough assessment of the client's presenting issues and subjective experiences is crucial, always within the bounds of hypnotherapy. Second, practitioners must continuously evaluate whether the client's experiences fall within their scope of practice and expertise. Third, if there is any doubt or indication of conditions beyond the scope of hypnotherapy, the practitioner must consult relevant professional guidelines and ethical codes. Fourth, a clear and transparent communication with the client about the practitioner's capabilities and the potential need for referral to other specialists is paramount. Finally, maintaining accurate and detailed client records documenting the assessment, interventions, and any referral decisions is essential for professional accountability. Question 20. Governance review demonstrates that a certified clinical hypnotherapist, CCHt, is working with a client who has researched Ericksonian induction techniques and specifically requests the use of confusion as a primary induction method, stating they believe it will be most effective for their anxiety. The CCHt has assessed the client and believes that while confusion techniques can be useful, a more direct, permissive induction might be more appropriate given the client's specific anxiety presentation and their stated desire for immediate calm. What is the most ethically and professionally sound course of action for the CCHt? Option A. Engage in a detailed discussion with the client about their understanding of confusion techniques, explain the rationale for considering a permissive induction, and collaboratively decide on the most suitable approach based on the client's goals and the therapist's clinical judgment. Option B. Decline to use any Ericksonian induction techniques and suggest the client seek a therapist who specializes in that specific area, as the CCHt is not comfortable fulfilling the request. Option C. Immediately proceed with the confusion induction technique as requested by the client, prioritizing their stated preference to build rapport and demonstrate responsiveness. Option D. Inform the client that their research is incorrect and that confusion techniques are not suitable for anxiety. Then proceed with a direct, permissive induction without further discussion. The correct answer is A. Engage in a detailed discussion with the client about their understanding of confusion techniques, explain the rationale for considering a permissive induction, and collaboratively decide on the most suitable approach based on the client's goals and the therapist's clinical judgment. Explanation. This scenario presents a professional challenge because it requires the certified clinical hypnotherapist, CCHt, to balance the client's stated preference with the ethical imperative to provide the most effective and appropriate therapeutic intervention. The challenge lies in discerning whether the client's specific request for a particular Ericksonian technique is based on informed understanding or a preconceived notion that might not align with their underlying therapeutic needs. Careful judgment is required to avoid simply fulfilling a request that may not serve the client's best interests, while also respecting their autonomy. An incorrect approach that involves immediately implementing the client's requested technique without further assessment fails to uphold the CCHt's professional responsibility. This could lead to an ineffective or even detrimental therapeutic experience for the client, violating the principle of do no harm. Ethically, it bypasses the crucial step of informed consent, as the client has not been fully apprised of alternative or potentially more suitable approaches. Furthermore, it demonstrates a lack of clinical judgment and an abdication of the therapist's expertise, potentially contravening guidelines that require practitioners to operate within their scope of competence and to employ best practices. Another incorrect approach, that of dismissing the client's request outright without exploration, disrespects client autonomy and can damage the therapeutic alliance. While the therapist's expertise is paramount, a collaborative approach fosters trust and engagement. Ignoring a client's expressed interest, even if it seems misguided, can lead to resistance and a breakdown in communication, hindering progress. This approach fails to acknowledge the client's active role in their own healing journey and may be perceived as paternalistic, which is contrary to ethical therapeutic relationships. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and exploration. Fully understand the client's stated preference and the reasoning behind it. 2. Comprehensive assessment. Conduct a thorough assessment of the client's presenting issues, goals, history, and any contraindications. 3. Collaborative treatment planning. Discuss findings with the client, explaining the rationale for recommended techniques, including the requested one if appropriate, and exploring alternatives. 4. Informed consent. Ensure the client fully understands the proposed treatment plan, its potential benefits, risks, and alternatives before proceeding. 5. Adaptability and flexibility. Be prepared to adapt the treatment plan based on the client's response and evolving needs, always prioritizing their well-being.